Every 40 seconds, someone suffers a stroke. Every 3.5 minutes, someone dies from one. The scariest part, many don't even recognize it's happening. But what if I told you that up to 80% of strokes are preventable? Knowing the warning signs and taking action could save your life or that of someone you love. Stick with me because what you're about to learn is crucial. A stroke occurs when blood flow to the brain is suddenly disrupted, depriving brain cells of oxygen, causing them to die within minutes. This can result in permanent brain damage, disability, or even death. There are three major types of strokes. Number one is ischemic stroke. This is the most common stroke, accounting for nearly 87% of all cases. It happens when a blood clot of a fatty deposit blocks an artery supplying food to the brain. Number two, hemorrhagic stroke. This happens when a weakened blood vessel bursts, leading to bleeding in or around the brain. It is often linked to high pressure, aneurysm, or headaches. Number three, transient ischemic attack, TIA, or mini stroke. This is a temporary blockage of blood flow that does not cause permanent damage but serves as a warning sign that a full-blown stroke may happen soon. If you experience a TIA, get medical help immediately. Time lost is brain lost. Recognizing a stroke early can make the difference between full recovery and permanent disability. Learn the first method. Letter F stands for face drooping. Ask the person to smile. Does one part of their face droop? Letter S stands for arm weakness. Ask them to raise both arms. Does one drift downwards? Letter S stands for speech difficulties. Their speech slurred or hard to understand. Letter T stands for time to call 911. Don't wait. Call for emergency help immediately. Other warning signs include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Confusion, trouble speaking, or difficulty understanding speech. Blurred or double vision or loss of vision in one or both eyes. Severe headache with no cause. Dizziness, loss of balance, or trouble walking. Strokes don't just happen out of nowhere. Certain factors put you at risk. Some you can control, others you can't. Let's break them down. Age. The risk doubles every decade after 55, but stroke can happen at any age. Family history and genetics. If a close relative has had a stroke, your risk increases. Race and ethnicity. African American and Asians have a higher risk. Previous stroke or TIA. Having one stroke significantly raises the risk of having another. Hypertension, the number one cause of stroke if your blood pressure is above 130 out of 80. So take action now. Smoking and excess alcohol. This damages blood vessels, making stroke more likely. Diabetes and high cholesterol. This contribute to artery blockage. Obesity and sedentary lifestyle. Lack of exercise increases stroke risk dramatically. Stress and poor sleep. Chronic stress and sleep apnea can trigger stroke. The good news, up to 80% of strokes can be prevented with simple lifestyle changes. Here's what you can do starting today. Number one, controlling your blood pressure. Keep it at or below 120 out of 80 by reducing salt intake, exercising, and stress management. Number two, eat a brain healthy diet. Focus on leafy greens, berries, nuts, fatty fish, whole grains, and reduce processed sugar and transient fats. Number three, get moving. Just 30 minutes of moderate exercises 5 times a week can cut your stroke risk in half. Number four, quit smoking and limit alcohol. This alone can dramatically reduce your stroke risk. Number five, manage stress and sleep well. Meditation, deep breathing, and 7 to 9 hours of quality sleep per night can keep your brain healthy. Number six, know your numbers. Monitor blood pressure, cholesterol, and blood sugar levels regularly to stay ahead of potential problems. If you have already had a stroke, here's how to recover faster. Physical therapy and rehabilitation helps regain lost movement and strength. Speech and cognitive exercise. This helps boost brain function after stroke. Support and mental health care. Depression is common after a stroke. Talk to a professional if needed. This information could save a life, maybe even yours. Don't forget to keep it to yourself. Share this video with your friends and family. Hit that like button if you learned something new and subscribe for more health insights. Have you or someone you know experienced a stroke? Comment below and share your story. Let's spread awareness and save lives. Remember, a stroke doesn't have to be a death sentence. Take control of your life and stay informed. See you again in the next video.